Thank you, Chairman Cassidy, Ranking Member Sanders, and welcome, Mr. Secretary. I have nothing personal against you. I don't even know you. But what I do know, as the former Deputy Secretary of Health and Social Services in Delaware, is how important your agency is to the lives of so many people in our country. During the confirmation, your confusion of Medicaid versus Medicare did not instill a lot of confidence. But today, as you talk about these budget cuts being painful, I am reminded of Delawareans who have come up to me and cried and said, please don't let folks take away my Medicaid, individuals with disabilities. While you talk about cutting this large department, there are talks about including more things in the department from the Department of Education. And so I'm concerned about that. And when we met in January, you committed to radical transparency and responding to all congressional inquiries within 30 days. Since then, we've sent dozens of letters. And to my knowledge, like Senator Hassan, I haven't received any responses. And given your stated commitment to transparency and your focus on efficiency and responsiveness in your opening comments, I think this is a great opportunity to get your commitment that you will respond to the letters from this committee, and also an opportunity to maybe talk about a few of the things that I wrote to you about. So let's begin with this letter. In March, I wrote to you expressing my concern about the delayed meeting of the federal vaccine experts, otherwise known as ACIP. The meeting of this committee is a key step in getting vaccines to millions of people, from babies to seniors, and delays can have negative impacts on vaccine accessibility and affordability. And while I'm glad that the meeting finally happened, we're quickly approaching flu season, and the CDC still hasn't adopted the April recommendations. And I can understand the delay given that there seems to be no current CDC director. So in the spirit of radical transparency, my question is, who is the acting CDC director?
The acting director was Susan Menares, but she is now up for permanent director. And so she's been replaced by Matt Bozzoli.
Does this person have a medical background?
I believe.
Or public health expertise?
He's a public health expert.
Public health expert. So the fact that the recommendations are kind of stuck is, and the fact that you kind of had a...
Well, can I clarify something? The ACIP does not do the flu shot.
Yeah, I don't want to get into the specifics of that.
And those, the flu shot was sent.
My question was more about, do we have a CDC director? And then I want to enter into the record information about what harms could be caused until we get one.
Is that a request?
We want the director.
I'd love to shift
We're
gears.
relying on this committee too.
But this was my question. This is my
I'm
turn.
the director.
We are senators, and so I don't want to have the same exchange that happened before with other people. I just want to ask my questions. I want to just shift gears. Your proposed compassionate budget would cut funding for multiple maternal and child health programs. And I know as a new parent, I remember learning that my baby should sleep on their back. The NIH Safe to Sleep campaign, you've shuttered. After launching this campaign in 1994, the rate of sudden infant deaths dropped by 50%. Many parents in this room maybe remember getting their children screened for hearing loss or rare diseases. That program has also been shuttered. You've cut programs that collect data on IVF, maternal health, infant mortality, all while President Trump is calling himself the fertilization president. None of these policies are based in compassion. And my only concern, even following up on Senator Kim's question, is understanding what goes into gutting a program that has increased, the efficacy of parents and being able to take care of their children. I will, my time is expired, but I will just say, again, a budget is a reflection of priorities, and to me, this budget, the cuts to Medicaid that are talked about right now across in the House of Representatives are going to have real, like you said, painful impacts on people's lives. And I hope there's some real compassion in the end. And I hope that you hear from our constituents as we are hearing from them as well. And we will continue to try to fight for them. So I yield back.
You've left me no time to respond, but I can assure you that I will act with compassion.
Senator Also Brooks.